Heart failure. Heart failure reflects an inadequacy of the heart pumping, so that the heart fails to maintain the circulation of the blood. The heart can't keep the blood moving all around the body, so the blood backs up into the body and into the lungs. It can be a result of impaired cardiac functioning. Maybe the heart muscle is too weak. Maybe there are leaky valves. Or it can be a result of excessive workload demands. The heart is trying to push blood into an area of increased pressure. And maybe the heart's trying to push forward and the aorta and other arteries are constricted, and it has to push too hard, harder than the work can handle. When we talk about heart failure, we look at left-sided heart failure and right-sided heart failure. In right-sided heart failure, we see that the blood is supposed to return to the right side of the heart, get pumped out of the right side of the heart into the lungs, around to the left side of the heart, and then back to the body. Well, if the right ventricle can't handle the work, not all of the blood goes forward into the lungs. Some of it backs up back into the body again. It can't get out of the body into the right heart. And it backs up into the liver and some of the other organs as well. So, we'll see congestion of the peripheral tissues. That means we'll see dependent edema and ascites. As it backs up into the GI tract, we may see anorexia, GI distress, and weight loss. As the fluids back up into the liver, we're going to see impaired liver functioning. Now, if the problem lies in the left heart, the heart is supposed to be pumping the blood forwards into the body, and if the fluids can't move forward, maybe it's meeting too much resistance or the heart is weak, either way, it's going to back up into the lungs. The fluid backs up into the lungs itself. And the blood's there, and then it's going to start leaking out through the vasculature. We'll see fluid in the lungs. So with left heart failure, there's a decreased cardiac output. Blood's not making it out of the heart into the body. If the blood's not making it into the body, neither is the oxygen. So we don't have the energy that comes from the oxygen. We'll see activity intolerance and signs of decreased tissue perfusion. With left-sided heart failure, we also see pulmonary congestion, fluid backing up into the lungs. So we have impaired gas exchange. That means cyanosis and other signs of hypoxia. And pulmonary edema. We'll have a cough with frothy sputum, orthopnea, and paroxysmal nocturnal dyspnea. The goal of treatment is to improve the quality of life for the person. And we can do that through improving cardiac output. Maybe it means surgery, maybe doing whatever you have to correct the underlying cause. Maybe that means treating hypertension. Maybe that means going in and looking at the valves and fixing the valves. We're reducing peripheral vascular resistance. I said, treating hypertension. We're increasing cardiac contractility, trying to make the heart muscle stronger and reduce the excessive workload. So maybe we can do that with medications. And we're also supplying supplemental oxygen.